Good afternoon. My name is John Warby, and I am the director of the undergraduate program in Nutritional Sciences. I'm here to talk to you today about our major and the options within it. Now, you may be asking yourself, what is nutritional sciences, let alone why should I major in nutritional sciences? Well, we think that you ought to study it to discover the molecular, biochemical, physiological, clinical, social, psychological, and cultural dimensions of human nutrition. Very important things in terms of the circle of life. As I alluded to a moment ago, I'll be discussing our options in nutritional sciences. We have four, predominantly dietetics, but also an option in biomedical nutrition, an option in community nutrition, an option in food service administration. And if you elect to choose another major at SEBS, they're not required, but many students do find these valuable to supplement their majors. You can minor in straight nutrition or in culinary nutrition. Let me start with our dietetics program because it really is in many ways the bread and butter, no pun intended, of our undergraduate program. Our dietetics option fulfills the requirements of a didactic program in dietetics, which is outlined by the Accreditation Council for Education in Nutrition and Dietetics. In other words, we answer to a higher power. Completing the option with a Bachelor of Science degree is the necessary first step in becoming a registered dietitian. Or RDN, a registered dietitian nutritionist, actually is the preferred verbiage these days. The RDs did want to make sure that people look for that credential instead of just a generic nutritionist, which may not necessarily have any training. And almost anyone can call themselves a nutritionist with a little bit of confidence, but getting what someone needs to know about nutrition, you want to look for the RD or RDN. Most RDNs start their careers in hospitals, but many will move on to consulting or to a private practice. Now, there is a cautionary note I have to share with you. A dietetic internship and master's degree are subsequently needed before the RDN examination may be taken. In other words, you don't graduate from Rutgers being a dietitian. It would be it'd be like saying you majored in psychology and you're a psychologist after 4 years. No, there is training that comes after that. So in the case of the registered dietitian nutritionist, you do need to attain a master's degree. At this point, it can be in anything. You could get an MSW or an MBA. We would recommend a degree in nutrition at the advanced level. You also have to put in hours in what is known as that internship, which then sets you up to be eligible to take the credentialing exam. Our second option is biomedical nutrition. This provides education and preparation for those students who are planning on attending graduate schools in life sciences, conducting biomedical research, or pursuing pre-professional studies such as medical school or dental school or pharmacy or physician's assistants, for example, or nursing. The nutrition option also prepares for entry-level jobs in biomedical research fields in industry and academia. Our third option is community nutrition. This addresses the growing need for nutrition professionals to work in organizations at the local, state, and national levels, such as the Women's, Infants, and Children's Supplemental Nutrition Program, also known as WIC, Head Start programs that are aimed at preschool-age children, 4-H programs, some of you may be familiar with from your own work when you were a bit younger, cooperative extension. Rutgers is the land-grant university, so we run the Rutgers Cooperative Extension, and there are numerous positions that are available there for community nutrition workers. It's also useful for after-school care programs, daycare centers, and a wide number of programs for children and families, senior citizens, and the homeless. Our fourth option is food service administration, and this option prepares students for careers in food service marketing or managing food services and organizations such as schools. Every public school has a school lunch program, and many now school breakfast programs. They need good people who know about budgeting, ordering foods, cutting deals and serving quality meals to children, or running restaurants, or overseeing cafeterias and industry, or in hotels, corporations, hospitals have cafeterias, and every long-term care facility for the elderly or individuals in need of care have a food service operation because people need to eat. What is the curriculum like? Well, you may have noted on a couple of those slides, that are actually all of them, we had a layout of what courses we would recommend a student take in their first year. But to give you the highlights of it, let's say that at the end of your first year, an interested student would declare pre-nutrition as their option or pre-dietetics as their option. Once nutrition and health, a required course, general chemistry, a required sequence, and the requisite biological science courses, general biology, for some students, principal biologies, for some others. Once they're completed, the students would then declare one of those four options I just mentioned: dietetics, biomedical, community, or food service. Several of the tracks do include additional life and physical sciences, like biomedical, for example, because we're adhering to the pre-med criteria, or additional foods courses if you are in food service, for example, and applied or community nutrition courses for the dietetic students and the community nutrition students. And some of the options require a minimum GPA for admission. We set the bar relatively easy to attain, 2.5 or C plus average. So try to get good grades. For more information, you can go to our website. Many students are interested in research. We are very interested in exposing the students to that. So all of our major options do have a hands-on experience-based education requirement. Biomedical nutrition actually requires a directed research experience where you would hook up with someone in the laboratory or at the medical school to firsthand get involved with research. The other options, by nature of the food service courses that are required, have hands-on experience wherein you go to some sort of food service facility off campus and learning in the trenches what being a food service individual might be like. Even if you're not in the straight research track, biomedical, all students are encouraged to try to seek that out if your schedule will permit it. Student organizations, going a little bit to the extracurricular side, there are a lot of opportunities for students to engage with other students in the major. We have a nutrition club. There's an organization called Nutrition Advocates where students share nutrition information in an organized fashion with classmates on campus. The Healthy Dining team has the special task of educating students who are on the meal plan, so that there are newsletters set up in the various dining halls where you will get timely information on good eating. The Harvest Cafe is one of the settings where some of our students work, very much 21st century type of food service operation. There are student health ambassadors, which promote health, but nutrition is a large part of that, who work for the Institute for Food, Nutrition, and Health. We have a community farmers market, which can put students to work, seeing people in the community sense and promoting fresh fruit and vegetable consumption. If you're a good student, you may be invited to the Departmental Honor Society, the Kappa Omicron Nu Honor Society. Life after graduation, as I said earlier, dietetic students, our bread and butter, really comprise most of our majors. But as I also said, you don't leave here a dietitian. You have to match to a dietetic internship after you complete our program, get that master's degree, eventually take that exam. In spring of this past year, 100% of our students matched, meaning that there was an internship waiting for them when they left here. For students in our other options, most of them have either entered graduate programs, gone on a medical school, taken sales or research positions in industry or corporations, or in many cases opened their own restaurants. I'm proud to say that one of our alums is now the director of dining services at the university. Very, very responsible position that he's got, and he's one of our own who had majored in food. Contact us. There's my information again, John Warby at your service. I'm very amenable to answering emails. I try to get back very quickly. If you're specifically interested in dietetics, Dr. Virginia Quick would be your go-to person. Feel free to look over the contact information for any of our faculty, which is on the Nutrition Rutgers Education faculty website. Just go to the Rutgers website, search nutrition. We should be the first link that you see. And feel free to follow us on Facebook. Thank you for your time. I hope you'll give nutritional sciences some consideration, and that we'll see you on our campus in a few months. Have a great senior year.